So good afternoon. My name is Dr. Alma Nenshi, and I am from Calgary. I'm the owner of the Chiropractic Wellness Clinic, and I am really excited to present this workshop on women's health. It's Women's Health 101, and it is all about the things that us women are dealing with every day. And I hope that this information will help give you the tools you need to kind of fill in the information that you may not have about certain aspects of women's health. So today we're going to be welcoming questions and anything that you may have in terms of what you would like to discuss about women's health. And these can be typed into the chat box, and we'll certainly discuss those. This is a safe place, right? This is somewhere where you don't have to be embarrassed. If you have any specific question that you might be struggling with, it's likely that 2-3 other people on this webinar might also have the same question. So please, speak up and put those questions out there, and we'll do our best to answer them. Okay. So one of the things that women tend to deal with from a very early age is PMS, and that stands for premenstrual syndrome. And it's a combination of symptoms that a lot of women get about a week or two before their menstrual period begins. And most women report getting some combination of bloating or cramps, headaches, moodiness, all of that, which is normal. So if you're getting cramps that are so bad that you're missing work or school, or it's interfering with your quality of life, then perhaps it could be a medical problem that needs attention. So that's when we recommend that you see someone such as your medical doctor to discuss these particular concerns. There have been studies on the effectiveness of chiropractic adjustments and how they help with lower back pain as a result of menstruation. And there's a lot of positive information on how people who get adjusted tend to have less lower back pain and cramping than people who do not get adjustments during their cycles. So I know I have several patients that come in on a regular basis to get adjusted so that they can avoid these PMS symptoms. So I just wanted to put that out there if that's not something you had ever considered, or perhaps there's someone you know that is suffering and have not considered that. So that's one of the things that we do. I'd like to take a minute to talk a little bit about birth control. And there are a lot of different types of birth control out there, and there are a few popular options. Of course, we have the birth control implant now. That is a small plastic rod that's about the size of a matchstick, and it's implanted in the inner arm, and it's about 99% effective, and it lasts about 5 years, and of course it's reversible. An intrauterine device is a small T-shaped device that's placed inside of the uterus, and there are both hormonal and non-hormonal options available. So with the hormonal IUDs, your periods get lighter and sometimes they go away completely. And with the non-hormonal, the periods can get heavier, but it does protect you from pregnancy, what they say, for up to 12 years. And the IUDs are about 99% effective. Anywhere they last between 3 and 12 years, depending on what type you get. And of course, it's reversible because you can remove them. I have had patients come in that had some scar tissue that develops around the IUD, so that sometimes it can be hard to remove, but it is something that can be removed. Your birth control shot is an injection that you get every 3 months, and they are 94% effective. And there is a birth control vaginal ring, which is a small flexible ring that prevents pregnancy by releasing hormones into your body. And once a month, this ring is placed into the vagina at home, and that vaginal lining absorbs the hormones. And that type of birth control is about 91% effective. Of course, the birth control pill is a very popular option for many people. And the thing with the pill is, and other types of birth control is it does have its risks. The birth control pill does increase your risk for cardiovascular disease like heart attacks and strokes. And then when you compound that with smoking, I think it's a 20 times greater chance of having a stroke or a heart attack if you're on the birth control pill and you're smoking compared to another person the same age that is not on the birth control pill and not smoking. So there are other key areas that we need to be concerned about when we're choosing these options. Of course, being protective, having safe sex with condoms should be is very important and should be practiced, because there is no birth control option that is 100% effective, and nothing is going to protect you. None of these are going to protect you from sexually transmitted diseases. You need to have that protection, and that is available through using condoms. And when you use multiple types of birth control together, your risk for pregnancy also reduces that much more. Okay. Another thing that we can be discussing is the pain that sometimes people experience when they have their menstrual period. Cramping affects about half of all menstruators, and people don't really understand what's normal and what's abnormal when it comes to cramping. So always check with your doctor. You can, if you're a patient of mine, you can ask me. If you don't have a chiropractor, you can also ask your medical doctor. Any type of pain that lasts more than 2 to 3 days, or any pelvic pain at times that are not when you're having your period. So there are other times when you're experiencing pelvic pain other than when you're menstruating. Also, if you're taking over-the-counter medication, such as an Advil or Motrin or something, and that's not offering any relief from your cramping, then that's something that you need to be concerned about and talk to your doctor. Also, if you're missing work regularly because of the pain, or you just intuitively know that something's just not right, listen to your body and get an examination, figure out what's going on, and talk to your doctor. If your cramps are making it difficult for you to go about your day, and your doctor may say, well, it's fine, everything's fine, don't worry about it, and there's something that's still nagging you about that, don't accept that as an answer. Be an advocate, try and get a second opinion, speak to other practitioners, do your research, find your answers, because no one's going to be able to protect you or look after you more than yourself. So it's very important that you listen to your body. Now, if you have severe cramping and that cramping is accompanied by fever, or if there's vomiting or dizziness or any type of unusual vaginal bleeding or discharge, definitely call your doctor right away. This could be a very serious condition. And remember, again, we mentioned this just a couple of slides ago, that chiropractic adjustments are very effective to help people who have pelvic and back pain with menstruation. And so that can help with this whole concept of dysmenorrhea or painful periods. If you've not tried it, or you know someone who is suffering and has not tried it, definitely consider it. Ovarian cysts. There are cysts that develop in the ovaries. Sometimes they are benign and painless and cause no symptoms. These are fluid-filled sacs, and sometimes as the cysts grow, there's several different symptoms that can come up. So you can get abdominal bloating or swelling as a result of the increased volume of the cyst in your abdomen or in your pelvis. You can have painful bowel movements, painful pelvic pain, either before or during your menstrual cycle. Definitely you can experience painful intercourse, pain in the lower back or the thighs. You can have breast tenderness, nausea, vomiting. You can feel faint or dizzy, and you may experience fevers. Now, these are all symptoms that may indicate that the cyst is very serious and perhaps had ruptured, or the ovary itself has shifted in the wrong way. You cannot prevent cysts really, but if you get regular examinations, these cysts may be able to be detected early on and save you from a lot of invasive surgeries to remove them later on down the road. And cysts can affect your fertility, so it can also prevent the risk of infertility and other complications if you're able to detect them early. I had a patient that presented with unusual back pain symptoms several years ago, and there was something just really odd about the case. Something was really nagging me, and so I suggested that instead of getting her treatment, she go to a local emergency room and not leave until they got someone to do a diagnostic ultrasound of her pelvis. And she called me about 3 hours after waiting in the ER, saying she was tired and she just wanted to go home. And I really encouraged her to stay. She had already been waiting 3 hours, so what's a few more hours there? And she called me the next day, and she told me that she had everything imaged. She was booked to see an OB that morning because they had detected a large ovarian cyst that was just at that verge of rupturing, and it was the size of a grapefruit, and it was referring pain to her back. So pain in the pelvis is one sign, but you can also have referred pain from from any type of abdominal problem into the back. And it's very important that you don't ignore pain. If you do experience pain in your back, that you're paying attention to it. You have someone looking at it and making sure that they're helping you to diagnose what the real problem is. Always make sure that if you have chronic pain that doesn't seem to go away, that you have consulted someone like myself or a medical doctor that can make sure that you get an accurate diagnosis of what's going on. So that's my little story about a patient of mine who came in with a routine back issue, and it actually was a life-threatening issue, and we were so happy that she followed instructions and waited in that ER, because who knows what could have happened if she rolled over in bed and that cyst had ruptured, and that would have been a really sad ending to that story. So I'm happy it didn't go that way, but really pay attention to any abdominal or pelvic pain and make sure you get an accurate diagnosis for that. So I'd like to talk a little bit about discharge. Vaginal discharge is something that no one likes to talk about, but we really know we should talk about it. What's normal, what's abnormal. So I'm going to list a couple of different types of discharge, and we'll talk a little bit about what it means. So if there's any thick white discharge, this normally is just normal discharge, and sometimes it could be clear and milky in color. It can vary in consistency from watery to mucus-like, but the smell should be very mild, and really, again, that's probably normal discharge. If you have a yellow or green tinge or yellow or green discharge, this is definitely abnormal, and it could be a sign of a bacterial infection or a sexually transmitted infection. If you have brown discharge, this might be caused by irregular period cycles. So if it keeps appearing, it could be a sign of serious uterine or cervical issues. So you definitely need to talk to your gynecologist about that. And very thick, white, chunky discharge. This is usually likely from a yeast infection. So accompanying symptoms could be itchiness, redness, irritation, and burning. So if you have thick, chunky, white consistency, then that's probably a yeast infection. So, of course, when we're talking about discharge, we're concerned about infections, and the most important infection that we're hoping to prevent here is urinary tract infections and yeast infections. So urinary tract infections start off with this constant feeling of needing to go to the bathroom and pee all the time. And usually if you drink a lot of water, you can try and flush out the bacteria buildup, but the infection, if it's not looked after, can spread to the kidneys because it goes from the urinary tract into the bladder and then up into the kidneys. And eventually that can spread into the blood and can cause severe health issues. So if you feel that you have a urinary tract infection that's coming on, make sure you get tested with your doctor, and then you may need antibiotics that they can prescribe to help you with that. In terms of preventing UTIs, hygiene is very important. If you're going to be intimate with your partner, make sure you go pee afterwards so that the urinary tract itself in women is much shorter than it is on men, so it's easier for the bacteria to accumulate into the urinary tract. And so if you just go to the bathroom and pee after, that would be good. And, I know it can feel a little awkward sometimes, maybe even be a little unromantic, but, this is your health. Think about your health and yourself. This is important. For yeast infections, the best thing you can do is cut back on your sugar. So think about, like, if you are a baker and you want to bake a nice loaf of bread, what you're going to do is you're going to mix all the ingredients, and then you're going to add sugar or honey to the yeast and some warm water to make it rise and try and activate the yeast. So if you want to reduce yeast infection, you have to get that away, the sugar away, because a warm, moist environment with a little bit of yeast and an ultra sugary diet, that's just a recipe for a terrible yeast infection. And you can relate that to baking and see how the yeast can help with your baking and how it just proliferates, and we don't want that for our bodies. Another thing that you can do to help balance the bacteria in your body is looking at probiotics. So bacteria and yeast exist in our gut, and probiotics can control the amount of that circulating. And especially if you've been prescribed antibiotics basically kill anything living in your gut. And you have healthy bacteria as well as not so healthy bacteria. So while you're trying to get rid of all of the unhealthy bacteria, it's good to put some of the good stuff back in. So prebiotics and probiotics are really important to help restore good bacteria and keep you healthy and balanced in your digestive tract. So that's something that I would recommend if you are on antibiotics, to consider taking pre and probiotics to help keep that area all nice and balanced. So I love sugar. I absolutely love sugar, and I know that's my go-to whenever I feel stressed. I want to get that little piece of chocolate or something that is sweet to taste. And they find studies have found that the average woman eats about 70 pounds of sugar per year. That's 70 pounds of sugar. That's probably half of most of our body weight per year. So sugar is hidden in a lot of things that we eat, which means that most of us are eating way more than what our bodies are meant to handle. And some argue the amount of sugar that we eat is actually toxic. So whether you're having sugar from the yogurt you have in the morning, or coffee, or granola bars through the day, or maybe you're having some alcohol later in the evening. Sugar finds ways to get into our gut and start to wreak havoc. So sugar causes inflammation, and the inflammation is often the result of inflammatory cytokines that are circulating in our blood. These are little markers of inflammation. And inflammation occurs when you have a lot of cortisol in your body. It causes weight gain, it depletes your energy, and inflammation can contribute to the progression of neurodegenerative disorders such as Alzheimer's disease and various types of cancer and heart disease and liver disease. So for those of you who don't know, the recommended limit for added sugar in our body is 24 grams per day. So this is where, when you look at food labels, it becomes really helpful, because 24 grams is not a lot. If you look at 2 tablespoons of ketchup, that's 9 grams. If you look at fruit-flavored yogurt, just like a 6-ounce container of fruit-flavored yogurt, you're looking at 31 grams of sugar. That's already past what your limit should be. Half a cup of pasta sauce has about 3 teaspoons or 12 grams of sugar. If you have a breakfast cereal bar, usually there's about 25 grams of sugar there. So it's very quick and easy to get a whole bunch of sugar into our diets. And so we really need to pay attention to the added sugar that we have and try and get rid of it. So we're going to move on to things a little bit less serious now. We can talk a little bit about our hair. You know, sometimes people have a lot of attention going to their hair, and some of us grab whatever shampoo's on sale, and other people put a lot of time and money into looking after their hair. Everybody looks after their hair differently. But regardless of where you fall in the spectrum, there's just a couple of things that I think are really important that perhaps you may not know. Number one, try not to wash your hair every day. If you do that, you're going to strip your hair of all of the natural oils, and it's going to cause it to get really dry. So try and wash your hair like every other day, and if you can, even every 3rd day. If you use a blow dryer or a straightening iron or anything that's heat, make sure you use a spray or a protectant that's going to help to coat the hair strands. A good conditioner can help you with that. There are leave-in conditioners that you can put in that can coat the hair, and also some really good conditioners that you can use in the shower. But when you use in the shower, just leave it in your hair so that your hair can actually absorb that moisturizer and have that conditioner coat it. And then when you're brushing your hair, it's important to use a comb instead of a brush when your hair is wet. So you always want to brush the ends of your hair down and then work your way up. And that way you're not going to pull on your hair so much and start losing more hair than you need to. We also don't want to leave out nail care, right? So in order for you to keep your nails looking and feeling their best, just make sure that when you file them, if you're going to file them, always file them in one direction instead of going back and forth. If you go in one direction, you're going to have less damage on your fingernail. And also, some people have a tendency to cut their cuticles. Try not to do that. When you cut them, you can open up the skin to infection, and that's not a good thing. So you can push them back gently if you need to. And if you have dry nails or a lot of hangnails or anything like that, just try and get some moisturizer and put that on your hand. If you want to use a concentrated moisturizer, you can use things like olive oil or coconut oil or shea butter or something like that, and you can put it on each of your nails and just coat them, and that can help them get better moisturized. Okay. So the way you start your day is going to dictate how the rest of your day goes. So having a routine that inspires you to be productive is really important. And one of the best ways to get into the right headspace for you to face your day is to try and do a little bit of reflection or meditation in the morning. And it doesn't have to be more than just even a few minutes, you know, as you just wake up and you get started, just sit comfortably and think about the things that you want to accomplish that day. You know, put out your intention of what you're going to be, you know, how your energy is going to be for that day. You want to be strong, be kind, be brave, send some positive energy towards those thoughts, and be grateful. You know, start your day in gratitude. And if you're not really keen on sitting quietly, you can think about all of those things while you're moving as well, but just kind of internalize and take a few minutes of reflection and meditation. You can do some gentle stretching, you can do some squats, you can do burpees or jumping jacks. It doesn't matter what you do, but just create a morning routine that's going to be focused on just a few minutes for you to reflect on what's important for you and to set out that momentum for how you're going to live for the rest of that day. And then the nighttime routine is just as important, right? So you want to end your day on the right note. So maybe you want to switch the lights down to softer lights after 9 p.m. Maybe you want to teach your brain that it's time to wind down by getting into the habit of preparing something warm to drink before you go to sleep. Like it could be tea or hot water with lemon or ginger. And then that warmth can help you with digestion as well. Some people on the seminar that we did on improving your sleep, we talked about trying to take hot showers or baths, because what happens is when you take a hot shower, when you come out of the bath, your body temperature naturally dips at night. And so when you're in a warm bath and then your temperature is really hot and then you come out and your body is gently cooling down, that's going to relax you and it'll be easier for you to fall asleep. There are some essential oils like lavender, or you can drink chamomile tea. These are all things that can help to relax you. And then you can also use that as a scent in your room to try and help to create that calm in your system as you prepare for a deep sleep. And yeah, we haven't really considered what's in the chat lately. So if there's anything that you do that you think is really helpful for winding down for the night and getting to bed, help you sleep, please share that in the chat. And that way everyone on the webinar here can learn from what you do as well. I like to listen to my brain tap. I don't know if you all know what a brain tap is, but we have light and sound therapy in our office. And MIT did a study several years ago about the effects of blue light in terms of helping to reduce the amount of plaquing in the lab animals that they were testing, that they had Alzheimer's and they had a lot of plaquing, and then those rodents that had been exposed to the blue light had reduced plaquing. So we actually have a technology in our office called Brain Tap. And what it does, it helps to entrain your brain and help you relax and de-stress. 15 minutes of it is like getting a 3-hour power nap. It's pretty amazing. And it really helps to try and calm and de-stress you, and the lights and the binaural beats and the sounds and all of that just helps to create that environment. And as a little thank you gift to all of you who've attended here today, I would provide you with a complimentary session of that Brain Tap if you'd like to enjoy that with one of your upcoming sessions in the office. Okay, so everybody's skin is different, so we need to look at what makes your skin healthy. And especially as we age, we're always looking for that little secret formula as to what's going to help you with your skin. And I think that, first of all, finding a skin routine can take a long time. And I think that there are just certain tips that I think can really help with that. Number one, most skin routines, they include some sort of toner, moisturizer, and serum. So a toner basically helps to balance and clean the skin. A moisturizer helps to add that extra nourishment, and then the serum gives you deep moisture, which helps your skin stay hydrated overnight. Now, sometimes people find that that's too much. I can't do that myself. My skin is sensitive, and so if I did that, I would start to break out. And my best routine, what I do, is we have a technology in our office called frequency-specific microcurrent, and I put a wet towel on my face, and I hook up the microcurrent on it. I don't even feel the current running, and that just helps to reduce inflammation and spring up the tone in my skin. And so that's very effective for acne and scarring and all that other stuff. Of course, you don't want to go and start popping any pimples or anything like that. I found that getting a clay mask and maybe some water or apple cider vinegar can help with that. And if you just apply that to your blemishes for about 10 or 20 minutes, and then you rinse, and then you repeat that a few times a week, eventually your blemishes will go away. So that's something that you can consider doing as well. But that FSM unit, the frequency-specific microcurrent, we have patients coming in with acne, and they put that on, and it just helps to take all the redness away and helps to calm the skin down, and it's just really amazing. So if you've never tried that, feel free to give me a call, and I'd be happy to share that with you. Sun protection is really important. Sunblock doesn't just protect you from getting burned, but it also protects the skin from cancer and wrinkles. So just make sure that you put sunscreen on your face every day, and try and find a moisturizer with a little bit of that SPF built into it, and just use it year round. And even on cloudy days, you still have those UV rays coming through, and it even comes through glass. There are some glass, some windows that are UV protected, but most glass, the UV rays will come through. So find a sunscreen that you enjoy, and then just reapply it before you go outside. Loving your body. You know, I can't tell you how many people, myself included, that keep a bunch of clothes in their closet. It's the I can't wait till I fit back into this, or I really like this, but it's just not quite right. So when I'm ready to use it, I'm not going to throw it out until I'm ready to use it. And you have that image of what you used to be able to wear. And granted, it may have been 20 years ago that you wore that, but you have to kind of get with the times. So, you know, social media and advertisements and TVs, movies, they all contribute to this concept that our bodies just aren't good enough. And that leads to a very unhealthy self-image. It can lead to unhealthy eating habits and dangerous dieting and all of the negative emotional stuff that happens from that. So try and look at those pages on social media that help you feel positive. So if there's anything that you look at and it makes me feel negative, just don't visit those pages anymore. Like, think of replacing them with those things and images and pictures of things that make you happy, make you feel beautiful, art, poetry, positive body images, that sort of thing. And, you know, I really think that having a way of positive self-talk and teaching your body or teaching yourself with repetition that you are loved and that you are good enough and you are worthy. These are all mantras that you could be reciting to yourself to help to improve that self-image, so that you know, you're not negatively affected by all that other stuff around. If you have clothes that don't fit you anymore, do what I did. About a month ago, I just went into my closet and I threw everything out that I wasn't wearing anymore. And it made lots of room in my closet, and it felt really good. It was really nice way of cleansing. So if you have things that don't fit you anymore, go into your closet and get rid of them. And don't think that it's, you know, I don't measure up to these things anymore. I just don't fit into them, so you're feeling bad about it. You know, donate the clothes and maybe, you know, set aside some cash so that when you're ready to go out and get some new items for yourself, you can get something that's really nice that fits you and also makes you feel good. So, you know, I think that having a positive body image is really important. We all have a body that God has given us, and so we should cherish it. And I think that the media doesn't help with that. So let's not feed into that. Let's just remember what's most important. And we are perfect just the way we are. So, you know, if there's anything that you do that helps you feel better about yourself or your body image, if you'd like to share that in the chat, that would be wonderful. I'd like to talk a little bit about anxiety. It affects millions of people, and you know, it's really hard when, especially with COVID and everything else that has happened, where our lives have completely changed radically over the last several months. People who have anxiety issues now have another layer of this on top of that. And there are different tactics to try and help calm your anxiety. Um, you know, you may want to try and separate yourself from what you're doing and just kind of move into a different physical space when you're feeling anxious. If you just physically move to a different room or a different place and start to deep breathe, like just breathe deeply, and do that with a 1-1-2 ratio. So let's say you inhale with your um, nose for 3 seconds, and then you hold it for 3 seconds, and then you exhale through your mouth for 6 seconds. And if you kind of have that controlled inhale, hold, exhale breathing, and you've removed yourself from the environment where you start feeling the anxiety or feeling stressed, that can help calm you down. Breathing is really, really important. You get oxygen into your body and all those tissues, and really helps to feel better. The other thing that you can do if you're feeling anxious is maybe find a buddy and just tell them, you know, I'm sorry, I'm feeling a little distracted today. I'm worried about blank. Or, you know, I can't focus on this because I'm just dealing with something, and please don't take it personally if I'm a bit distant, but just I'm dealing with something. So just talking about or acknowledging that you're feeling anxious to somebody else might help you feel better in terms of trying to deal with it. Some people find that if you write out your thoughts, all that stuff that's floating around in your head, if you just write it all down, then you can take that volume of whatever you've written and you can file it away, and you give yourself permission to let it go. Because if you ever need to revisit those feelings, you have a document that you can look at that will have all of that in it. So jotting down, writing down what you're feeling, whatever's going on that's making you stressed down, just jot down everything that you're thinking. It'll not only help you process your thoughts, but it'll help you release a lot of that energy. Again, we talked about the brain tap light and sound therapy. That helps to entrain your brain so that you feel more relaxed. There are over 800 different programs, guided visualizations, that can help you from reducing stress to weight loss to getting over bad habits, helping with you know, diabetes and hormonal issues, improving your sleep, even improving your golf game or learning how to public speak better. You know, there's so many different things out there, but it's the lights and sounds that really help to relax you. And I think that it would be really great if every one of you who've attended here today will experience that for yourself. And forgive me, I'm just going to take a second here to take a picture of the people who are on the call today so I can make sure. There we go. So I can make sure I send you a special e-bite for that. All right. So if there's anything that any one of you on the call are doing, any one of you on the webinar is doing to help you with anxiety that has been really helpful for you, if you struggle with anxious thoughts, if there's anything that you do to help yourself feel better, please share it with the rest of us here in the group so that it might help someone else who's on the call that might be struggling as well. Okay, so self-care. Self-care is a term that we hear about a lot. It refers to the practice of taking an active role in protecting your own well-being and health during times of stress. So here's some ways to practice self-care. First of all, plan your meals for the week. Make sure you include nutritious foods, and by planning them, you're going to be able to save money because you're not going to be tempted to go out and eat all the time. So if you plan out your meals, that's one way of looking after yourself, caring for yourself, because you know you're including the right nutritious foods, and it's going to save you some money. Consider taking power naps. When you need to, when you're feeling stressed out, taking a 20-minute cat nap is a great idea. It just helps you disengage and refresh yourself, and then you can come back and deal with what's still there when you're done. All the really yummy foods that you really enjoy eating, that donut or potato chips, having them once in a while is not a bad thing. Enjoy them. Don't feel guilty. Just enjoy them in moderation. So if you want to have something like a donut, go in, get your donut, and eat it with all the love that you have, and just enjoy it and indulge in it so that you get maximum enjoyment from it. And then you're going to be satisfied and you won't be craving that all the time. So when you do allow yourselves to eat those special foods or have those special treats, make sure you do it in moderation, but when you do it guilt-free. And of course, make time to laugh with your friends, be with your friends, talk to them, even if it's through a Zoom meeting or FaceTiming them or whatever it is. Try and laugh and be with your friends, and that's a great way to kind of get out of any type of stressful situation. So how many of you on the webinar here feel that you might be a bit of a people pleaser? Well, it's easy to say that, that when someone asks you for help, you're always saying yes, and you always want to help people. But then when you do, it seems that you're taking away from time or energy that you need to be focusing on to try and help yourself and your families or whatever else you're focusing on. And so pretty soon you're kind of doing things for other people all the time, and you end up just drowning in stress yourself. So I think that it's important to have boundaries and to put your foot down and say, you know what, I'm going to be strong and I'm going to use positive language. And if someone asks me to do something, I do have a choice to say no. If someone asks me, doesn't mean that I always have to say yes. If someone asks me, you do have a choice to say no. And if you're not sure, or if you feel uncomfortable saying the N word, the no word, you can always say, you know what, let me think about it and I'll get back to you. So just give yourself a little bit of delay in your time so you have a chance to, try and get that, try and get strong, and just keep your response really simple, right? You don't have to go into a whole explanation as to why you're not going to be able to help them or do what they're asking you to do. You can just say, no, I don't think I'll be able to do that. And just leave it at that. And again, if you're not able to say no, remember you can postpone it and you can say, I'll get back to you. And you can also consider kind of compromising too. If you want to help them, but you have limited time or ability, you can just say, hey, you know what? I can help you do X, Y, and Z, but I can't do all of it. Or I can help you for a half hour on Thursday, but that's all I have. Or you can put a little a caveat around it to say, yes, I'll help you, but it's within these boundaries that I'll be able to help you. And of course, understand that it's your right to say no. You're turning down a favor. You're not turning someone away or abandoning someone. You're just saying no to a request that they have, and that's okay. So I just want to make sure we spend some time talking about that, because I think as women, we're caregivers and we look after a lot of people, and sometimes we may not be able to look after everyone and look after ourselves at the same time. So we do need to have those boundaries. So again, this kind of leads into, you know, putting yourself first. You remember on an airplane when you're flying, when they talk about those oxygen masks and they say, well, make sure you put your oxygen mask on yourself first before you look after someone else. And that's what life is about. You have to look after yourself first, and you don't have to be afraid that by doing so, people are going to stop liking you, or you don't feel worthy of that love or care. These things are not true. You're not being selfish by putting yourself first. On the contrary, by looking after yourself, it's going to help you be more productive, more happier. It'll help you be more energetic, less stressed, and maybe even less depressed. I think that you need to set aside each day a little bit of time to do something that you want to do. And it doesn't have to be an hour or 3 hours or anything like that. It could be like 10 minutes. Set aside a little bit of time every day to do something that you really want to do, and make yourself a priority. Invest in things that keep you happy, that keep you healthy. You know, if you were going to buy something nice for a friend, buy it for yourself, right? You're going to cook a nice meal for a loved one, make it for yourself. Just little things like that, just to make sure that you enjoy and you pamper yourself. And remember, you can't do everything on your own, so it's okay to ask for help when you need it. Don't let your pride stand in the way. Make sure that if you are needing some assistance, then you need to ask for it. And, you know, if people start to get upset or angry with these new types of behavior or actions that you have, you know, it's probably because you've not been looking after yourself as much as you should have. And so as long as you're true to yourself, those people who are in your life that love you will support you, and they will support you to look after yourself and care for yourself. And those are the people who are going to be worthy of being in your life, and for you to have relationships with them. So you want to be able to find out who are your real people, who are the people that make you happy and healthy. They're going to be the ones that are going to be supporting you in this. So put yourself first, make yourself a priority, do something nice for yourself, even if it's for just a few minutes a day, but do it every day, and start acknowledging how important you are in your life for yourself. Okay? So as women, there's a lot of pressure sometimes to fit into this particular mold. I'm a mother, I'm a daughter, I'm a wife, I'm, you know, a doctor. I mean, whatever it is that we all have these specific roles that we feel that we need to be in. In addition, we have to be a certain shape, we have to have smooth skin, we have to wear the right clothes, we have to act the right way, we can't speak inappropriately, we have to eat everything that's healthy for us. I mean, nobody can do everything. Nobody can fit into all of these expectations and still be happy. Nobody. So don't feel that you're not good enough because you don't fit into all of these society's expectations either. That, you know, you may not want to have a salad at every meal. Maybe you want to have the poutine. And if that's good enough for you, once in a while, grab the poutine. And again, don't be feeling guilty about it, right? You don't have to have that perfect body. I mean, if the hair grows a little bit on your legs for a few days, big deal, right? I mean, look at the guys who go in the swimming pool. They don't shave their legs, right? So really, it's what are your ideas about yourself and your how you fit into society's image of what you should be, and try and reconcile what you're willing to accept and what perhaps might be skewed that isn't really reality, right? Don't feel ashamed for choosing to say no to something that you don't want to do or that you don't fit in with, because I think that that's embracing who you really are and getting to know yourself and getting to understand what makes you tick. That's really critical. You know, we all are fantastic. We're beautiful. We're intelligent. We're all worthwhile. We deserve gratitude and health and love. And so don't second guess yourself about anything. If something doesn't feel right, your body is telling you that it's not right for you. And listen to your body and embrace who you are, and then live your life with authenticity. So we're at the end of our seminar today. I have a number of resources here that have helped with creating this presentation. And as always, when I post the recording on YouTube, I will include the resources there so that anyone who's interested can follow the links and read more about them. And I'd like to ask if there's anyone who has any questions, please go ahead and put them in the chat box. As soon as we're done with this workshop, we will go ahead and answer those questions. Thank you so much for taking the time out of your busy day to join me today. I just absolutely love talking about health and wellness, and I hope that some of the things that we talk about on these workshops are things that you find very valuable. I speak from the heart, and I really want to say that I really appreciate your time and that you would spend that with me. You know, it's just amazing. I'm proud of all of you for taking the steps for trying to be healthier and happier. And I wish you great success with finding your authentic self and living your true colors, because I think that that's what is the source for true happiness. So thank you so much for being here today. I really, really appreciate that. If you have any questions or concerns, you can always contact us. Our website is calgarywellness.com, and you can feel free to get in touch with me anytime. I'm here for you. So thank you so much, and I'm going to sign off.